We are honored to have Dr. Ahmed Ogwell Ouma today with us, and we will be discussing a number of things related to the pandemic that we have. We know that the coronavirus pandemic is a public health crisis that we've never seen before, especially in living memories for most of us. And according to Africa CDC, on an update they gave on the 13th of May, that's yesterday, 53 African Union member states have reported more than 69,000 cases of the disease, with more than 2,400 deaths and almost 24,000 recoveries. And the numbers are going up as earlier predicted. So today we will be having a fireside chat with Dr. Ogwell, who is a global health expert and the Deputy Director of Africa CDC. Africa CDC is Africa Center for Disease Control and Prevention. It is a technical institution of the African Union that is strengthening the capacity of the member states to respond quickly and effectively to disease threats. So welcome, Dr. Ogwell. We will just like to discuss the status of the COVID-19 pandemic in Africa, the future outlook of the perspectives of especially continent scientists and health professions, and appropriateness of different measures that have been put in place or are being put in place by African governments and African unions, of course, with the lead of Africa CDC. So first of all, I'd like to welcome you to this conversation. And for the audience who are watching us, please, if you have any questions, share with us on either Facebook, on YouTube, or on Slido, or any channel that you're using. We will make sure we answer as many questions as possible. My first question to you, Dr. Ogwell, is, first I would just like to, commend the work that, the Africa CDC had put for preparatory measures and your proactiveness in interventions to help African countries to, reduce significantly the outcomes that had been predicted on the continent. So please share with us more about the work that you and the CDC have been doing.
Thank you, Sheilah, for having me here. It's a pleasure to be here. I'm trying to look for where the fire is, but I think it is everywhere now. So it's really a pleasure to be here. Maybe I start by just giving quick figures for today. The figures you quote are for yesterday, and as of this morning, we give updates, by the way, every morning at 9 and every evening at 6, because the outbreak is evolving quite fast. So as of today morning, we have 54 member states now of the African Union who have reported positive cases within their territories. And the number of cases so far is 72,000, just 396, 72,396. So that is where we are. And of course, it is important to remember that people are recovering as well. Many times we report on the cases, we report on the number of deaths, but then we forget that people are recovering. So as of today morning, we have over 25,000 recoveries and just under 2,000, just over 2,400 deaths. So if you look at from yesterday to today, the numbers have changed a bit. So that is in as far as the epidemiological situation is concerned. Second is to say something about Africa CDC. We are a specialized agency of the African Union, established since 2015, officially launched in 2016 in January. So we are right now just over 3.5 years old. and thrown into the middle of this crisis. We are trying our very best to be able to support our continent to stem this tide of COVID-19. So Africa CDC's mandate is to respond, prepare and respond to any public health emergencies on the continent. Indeed, any disease outbreaks that may have come on the continent, on the invitations of the governments, we usually go in and provide support to governments to tackle these public health emergencies and disease outbreaks. Now, let's go to specifically onto COVID-19. The first case was in, or actually February 14th, a significant date for many people, on February 14th of 2020. That was the first case. And that was in Egypt. After that, it spread to other countries progressively. And today we have 54 countries that are affected in a very short span of time. You can imagine mid-February, and right now we are in mid-May. It is basically within 3 or so months, we have the whole continent covered. Literally all the countries have been affected one way or the other by the virus. Now, the picture in Africa is one that has caused a lot of discussion. We started late compared to other parts of the world, and we have theories why that has happened. We are still studying the evolution of the outbreak, but essentially it came late because the epicenter was China, and the level of travel between Africa and that particular part of China was not very high. A lot of the business that has gone on between Africa and China has been with other parts of China, not Wuhan. Wuhan is largely a place where students go and they stay. They go for their studies, and then after that, during holidays, they leave. So this is one thing that could have contributed to it slowing down. Second is that in Africa, our modes of travel are relatively modest in terms of numbers. We travel by vehicle, we travel by buses. Motorbikes as well for those who are in the eastern part of Africa. In Europe, in Asia, in North America, travel is by air. So you find a lot of movement of many, many people in a very short space of time. In Africa, not too many people are moving in a short space of time. And when people travel somewhere, they tend to stay for a while. So this helped to contain a bit the spread of the virus. The third thing is the profile of individuals who were getting exposed to this virus in the beginning were largely travelers. And when travelers come from wherever they have traveled, they usually stayed within the urban areas. And because countries already had started enhanced surveillance, they could pick out these individuals relatively fast and quarantine them, isolate them, so that the spread into the rest of the country was not that big. That is why it took a bit of time for the numbers to start rising. Nevertheless, over time, the numbers have started to rise because of interaction of human beings as we know it. So Africa also learned some lessons from the Ebola crisis of West Africa in 2014, 2016. And some of the key lessons we learned that we've put into use now, and we can see are bearing fruit, include the following. One is the setting up of the Africa CDC was a very key decision that the heads of state made. It meant that Africa now had its own public health agency based here in Africa, funded by African governments, staffed by African citizens, and so working very closely with African governments to be able to identify outbreaks, provide support, and contain these outbreaks. And we've been tackling many, even as we speak today, there are 6 other outbreaks that are going on in Africa, but we're not talking too much about it because everybody's talking about coronavirus. So the establishment of the Africa CDC is one key lesson we learned, and the presence of Africa CDC, I must say, has made a difference. Second is solidarity, neighborliness. We learned that if countries come together and plan together and act together, then they are way more likely to address an outbreak fast and efficiently than if countries were working on their own. I'll give you an example. At the beginning of this outbreak on the African continent in February, we had no country with the capacity to diagnose in the laboratory this new coronavirus. Working with countries that had some level of capacity, before the end of February, we had 2 labs, one in South Africa and one in Senegal. Today, as we speak, we have 52 countries with the capacity to test within their own countries. So in a very short time, we have built the capacity from literally 0 to almost all countries can be able to test. This was the result of countries coming together, building their capacity within the continent with support from Africa CDC, and sharing the resources they had. The experts that were training were coming from different countries, and countries were not holding on to their experts to say that you must stay home. We were transporting them to the different locations where the training was happening. And so the solidarity came very, very handy, and countries were able to ramp up their capacity for laboratory testing. So solidarity is the second lesson that we learned and we put into good use. The third lesson we learned is start early. The Swahili have a beautiful saying that if you see your neighbor is being shaved, then put water in your hair so that it is soft. When your turn comes, it is not as painful. So when we saw this is happening in China, it is spreading into Europe, it is spreading into North America, we came together as Africa. And the first case, as I said, was diagnosed on February 14. And 1 week later, on 22nd of February, health ministers from all the 55 member states came together in Addis Ababa here and met to launch the Africa Joint Strategy for Coronavirus outbreak. So we started with a strategy very, very early in the process. By coming together and just putting our heads together, what can we be able to do to not to wait until it arrived. We literally started as early as was possible. So this is third. And finally is friends. Friends are an important resource. When this outbreak started elsewhere in the world, we started learning from China. We started learning from Europe, particularly Italy and Spain. We started learning how they were coping. South Korea, for example. How were they coping? What were they doing right? What could they have missed that we needed to do so that we protect ourselves? Starting early was an extremely good move that we made, but using the experience of friends ensured that we had good knowledge before the virus actually arrived in a big way onto the continent. So these are some of the experiences that we had and the way that we've responded to the presence of coronavirus on the continent. Over.
Thank you so much. Very good insights from you. And you mentioned something that I think a lot of people have actually, especially in the medical field, discussed, the fact that in terms of understanding the disease and combating outbreak, especially with limited resources, Africa has been or is much better prepared because we deal with outbreaks almost on a permanent basis. In your speech, you also mentioned we are going through 6 other diseases, but nobody is mentioning that. So with that regard, what are we doing? Also the fact that you mentioned that a lot of countries, 52 countries now have a capacity to test. What is the status for mass tracing, testing and capacity from the different countries in the continent? And what are we doing to make sure that especially leveraging some of the things we've used in the past, like for instance for polio, to make sure that these three very important disease containment and combating measures, especially for mass and the citizens are affected. Is there anything that governments are doing or in place to ensure that mass testing, tracing, and tracking is capacities enhanced?
Sheilah, yes. This is one of our most recent initiative that we launched as Africa CDC. The last week, 22nd to be precise of April, we launched an initiative called Partnerships for Accelerated COVID-19 Testing. We call it PACT. This initiative intends to do three things. The first is that within the next 4 weeks, that is by the end of May, we want to have supported governments with 1 million tests. So we want 1 million Africans to be tested over the next 4 weeks. Second is over the next 24 weeks, we want 10 million Africans to have been tested. And the third thing that this initiative intends to do is to mobilize partners, whether they are member states, whether they are institutions, the UN system, to mobilize partners to drive this testing initiative that we have launched. The reason why we are focusing on testing is because you need to know what your burden is as a country to be able to prepare for it appropriately, and then you know what kind of effort to put in. We don't want a situation where you're putting in an effort worth 10 and yet you need an effort worth 100. It means it will hit you very hard, and the crisis will become multiplied in a very big way. Or you're preparing too much and yet what you need to do is much smaller. It means resources can be put into other uses instead of being put for COVID-19. So testing is coming with 3 pillars. The first pillar is tracking. We want to track the individuals who have the profile of persons of interest. When we track these individuals, we will test them. And those who turn out to be positive, we will trace their contacts. So you start from tracking, you go to testing, you go to tracing of contacts, and then eventually those who need management, we will treat them. But the vast majority we know usually do not need any treatment. But these are the pillars that we are going to use in ensuring that we get to the 1 million in 4 weeks and the 10 million in 24 weeks. Now, this particular initiative is geared at, I want to avoid the term mass testing. Mass testing suggests that you're picking anybody and testing anybody. It is a waste of resources. The tests cost money. It is in the range of between $25 and $35 for each test. And we want to make sure that those tests are being used on the people who deserve it and are going to make a difference in as far as response by any government is concerned. So I'll avoid using the word mass testing, but it should be targeted testing, where we are reaching out to literally everywhere in a country and then testing those we know have a profile that need to be tested. And after the testing is when we can go to do tracing if someone turns positive. So the strategy that is in place is one of targeted testing, utilizing community workers who will then go out into the communities, provide the correct information to members of the public, assure a member of the public that testing positive is not a death sentence. Testing positive simply means the virus has reached you, and we can be able to then provide you with the necessary health care for you to recover. And many people are recovering, as the numbers are showing us. And also to provide information to the members of the public that when you are when the teams for testing come, don't run away. By protecting yourself, you're protecting others. by availing yourself for testing, you're actually still protecting others. So the message has to go out to the community to a level so that people are willing to take the test, and those who are found to be positive are quickly isolated. That way they don't continue to spread it in the community. So this is the strategy that we have. And as Africa CDC, we are making available the 1 million tests within the next few weeks, 4 weeks. And we are also going to make available the 10 million tests over the next 24 weeks. So this is our contribution. We are working with the manufacturers of the test kits to make sure that they reach Africa. And we are working with the national level governments to make sure that they reach country level. And we already trained a lot of laboratory technicians who will then be doing the sample collection and eventually the testing. So these are the things that we put in place to ensure that we can be able to have a good picture of what the actual burden of this COVID-19 is in Africa. Over.
Thank you. I think that's a very, very good response, because I think a lot of people have been wondering about, mass testing, and it's been, especially in the media, being put across as something that should be done. So thank you for demystifying that. You've also raised a very important factor about stigmatization of, especially from the society, of people who test positive, and also how we respond to them after they recover from the disease. So is there anything that governments are putting in place to make sure that not only we demystify the disease, in that there's no fear of loss of life, fatality, but also focusing on recovery, and not just that, also combating the stigma, because we hear stories from time to time about how people are not getting integrated well into their societies after they get back and they're fully recovered.
Yes, Sheilah, indeed, there is something that is going on in a very sustained manner. First is, as Africa CDC, we have been building the capacity of governments in risk communication. A disease such as this one, and with a very high speed of spread, results in fears of many people getting exposed. And the human being usually reacts to fear with panic. And to stem panic, what we are doing with governments is providing guidelines to governments so that information is provided to the citizens on a regular basis, because this then addresses all the rumors and the fake news that is out there. So we have trained around now 38 countries in risk communication. And after this training, what we are expecting governments to do is that they will have teams of communicators who will be collecting information from government sources, and then who will be providing that to the members of the public through the media, so that information that is correct is out and available to the public. Second is the regularity of the briefs should be such that there is no gap in rumors, because what really causes damage is panic, which results from rumors. So that's the second thing that we are doing with governments. And the third, around stigma, is providing the correct information about the virus. The correct information about the virus is that about 85% of those who contract the virus barely know they have it. They will not have serious symptoms or no symptoms at all. Someone may sneeze here and there, cough a bit, but then that's it. So the vast majority do not get ill. Now, that's a good thing and also a very bad thing. It is a good thing that the majority will not get ill, but it's also a bad thing that you don't know you have it, so you can be able to spread it. Now, of the 15% that is remaining, a very small proportion of about 4% or so are the ones who will really get sick and will require high dependency attention, whether it is ventilators or ICU facilities. A very small proportion of about 4% are the ones who are going to get critically ill. The rest will get ill, but they can be able to recover with a good management in a hospital facility. So With stigma, we are working with governments to provide information so that members of the public appreciate that they are the ones who can actually be able to stop the virus from spreading. And if we do what has been given as the appropriate measures by government, we follow those measures, we follow those instructions, we can be able to limit and eventually stop the spread of the virus. So the source of problems of stigma is really news, fake news, misinformation in the social media. This is the source of the stigma that we are seeing. Also, misunderstanding the disease results in another aspect of stigma, where people imagine that if you have recovered, you're still able to pass it on. People imagine that when you get this disease, that is the end of you. People imagine many things that are incorrect. And this causes a lot of panic, and this causes a lot of stigma to the population. So we are working with governments in terms of risk communication to get the correct information out there, and encouraging governments to also pass positive information about the illness. We need to be talking positive things. How many people are recovering rather than how many people are dying. We need to have positive information of how many people are actually not very unwell, just briefly unwell, and then you recover. We need to pass the information that a very small proportion. Right now, the average case fatality rate, that is the number of people who will eventually, we are seeing are dying from the disease, is about 4 to 5% globally. So although those are human beings, 4 to 5% are still human beings, but the message is the vast majority will actually not end up dying. And this is important because it has an impact on the way that members of the public relate to and appreciate the issues around COVID-19. It allows members of the public to also know that there are risks of contracting, there are risks of suffering from COVID-19 in a big way are not that high. But the fact that the majority may end up not having symptoms but still be able to spread it is why we are so insistent on social distancing. We are so insistent on lockdowns in special circumstances. We are so insistent that we must make sure that members of the public are not exposing themselves unnecessarily by closing borders and things like that. Simply because the person who has it, you may not be able to tell. And as the virus passes on to other people, the weak ones are the ones who are going to get very sick, and they are the ones who may be in danger of death. So we're working with governments to try and address these rumors and fake news, and of course, address the stigma part by giving the correct information. Over.
Thank you. I think you've raised a very important point that I think a lot of, especially entrepreneurs, are worried about. The issue about lockdowns. What is your opinion about the impact of lockdowns on countries, and what is the fine line between, opening up too soon or too late?
We are just finalizing our guidelines now for easing lockdowns, and this will be made available early next week to government so that we can be able to see the lockdowns being eased. But we must step back and see Africa, the business is largely daily. You go out, you earn a living. The vast majority of Africans are in that category. So it means when we lock down our countries, we are removing from work a very large chunk of the population. And with it comes the risks of the inability to take care of oneself, food requirements for the day. Indeed, for the month, you may not be able to pay for your rent. So we are very sensitive to the fact that most of Africans earn their daily living on a daily basis. They are not salaried. Second is the effect on the economy. We're already seeing it. The economies have slowed down, and businesses are in very difficult circumstances. Employees are losing their jobs. and they are also in very difficult circumstances. Indeed, governments are losing revenue because when there is no economic activities, the tax base is heavily reduced. So every layer is actually impacted, and most of them negatively. We, as Africa CDC, had issued guidelines before on social distancing, which includes closing down public places, schools, places of worship, markets, public transportation, borders. And now we are in the process. We have appreciated what governments have done in as far as the lockdowns are concerned, and businesses have also appreciated that it was necessary to do that so as to limit the spread of the disease. The effect on entrepreneurship is significant and heavily so, and negatively so. But the alternative is worse. If we had not instituted strong social distancing and mechanisms, then you will find many people will be exposed. And if you look at what has happened in other parts of the world, particularly Italy and Spain and China, and now the US is coming there, if the spread is not checked early, then suddenly the numbers just go wild. And in Africa, our healthcare systems are very fragile. They are weak. We have few healthcare workers. We don't want those numbers to be big, because if they're big, the healthcare system will get quickly overwhelmed, and indeed, economic activities will come to a standstill due to the very, very negative impact of huge numbers being diagnosed at the same time. At the moment, the numbers are not as big, but they're still big, but they're not as big, and our healthcare systems are not being overwhelmed by very, very sick people, which is a good thing for us. So we are going to issue guidelines next week on easing the lockdowns so that we can slowly be able to go back to economic activities. But bottom line is going to be how disciplined are we to be able to follow those guidelines. That way the guidelines are working for us. If we don't follow the guidelines in a disciplined way, then the easing of the lockdown can have a very negative and opposite effect to what we have designed it to be. But it is time to start loosening up a bit with correct information to members of the public so that they know what they need to do to keep their distance and limit the transmission of this virus. Over.
Thank you. That's quite encouraging to hear. So I'll take audience questions. So please, if you have any questions, we don't have as much time, but we have 3 questions so far. So I will just read the 3, and then as we wait for maybe 2 more questions, and then we can close the session. So the first question is, what are the challenges of an African response COVID-19 that strengthens people's confidence in continental health resilience initiatives? The second question is, what do you think of the organic COVID developed by Madagascar to deal with coronavirus? And then the third question is, what do you think that the critical voices coming from civil society regarding the alarms of the WHO, are they justified? So maybe you can take the question on the challenges of response, especially in strengthening people's confidence in the Continental Health Resilience Initiative, and the one for the organic medicine developed in Madagascar together, and then maybe the other one about voices from civil society.
Yes, thank you. Maybe just to quickly dispense with the herbal therapy from Madagascar. As Africa CDC, we are a science-based organization, and we have reached out to Madagascar so that they can be able to give us their data. We want to analyze the data and see what the actual results of the therapy is. We also want to see what they have filtered out of it, what are the active ingredients, and in what proportions. And the third thing we have asked for is that we need at this stage to have other centers doing tests on that particular therapy so that we can reproduce results over different parts of Africa before we can be able to make a pronouncement on it. So at the moment, we are at the stage of waiting for their data. When the data comes, then we'll collect the therapy and share it with our multiple sites in Africa and get a proper clinical trial running so that when we are saying this thing works, we are confident scientifically so that it works. This is where we are with the Madagascar therapy. But I must add that there is absolutely no reason why an effective treatment cannot come out of Africa. Nobody has the monopoly of coming up with vaccines or coming up with treatments. That is a God-given right that we all have our capacities, and we are looking forward to some of these treatments actually starting here in Africa. And that is why as Africa CDC, we are following the scientific path so that when we say this one works, it works. When we say this one doesn't work, it doesn't work because we have the data for it. So for Madagascar's therapy, we are still studying the data. Second is around systems, the resilience of our systems. Frankly speaking, Africa has health system. Many of the wealthy countries don't have health systems. They have wonderful health facilities. But then in terms of a system, Africa has, because we will always start all the way from the village. You find your dispensaries, you go to your clinics, as it comes up all the way to the hospitals. So there are health systems that are present in Africa. The only problem is that they're weak. And they're weak because the healthcare workers are few. So they work long hours, difficult working environments. And secondly, the equipment that are required to make work easier for the healthcare workers are few. So work is not as easy to achieve good results. Nevertheless, what we have done is developed a very comprehensive response plan where we are not only looking at the COVID-19 possible cases, but we are strengthening the whole healthcare system so that maternal and child health is well covered. HIV/AIDS is well covered, TB is well covered, malaria is well covered, diarrheal diseases are well covered, other chronic illnesses like diabetes and hypertension, cancer, all those need to be well covered so that we are not ending up losing people from other conditions as we focus on COVID-19. So the resilience of the health system will be seen depending on how well a government has invested in expanding its reach within the community so that people who are unwell don't sit at home. They need to come out. They should not fear COVID-19 if they're taking appropriate measures. They need to come to the healthcare facility so that they're treated and we avoid unnecessary deaths. This we expect is going to be possible so long as we keep our numbers down, so long as we try and flatten that curve, so long as we protect our healthcare workers so that they are not getting infected by this coronavirus, because they are few. If they get infected, then there'll be nobody to look after the patients in the healthcare facilities. So these are part of our comprehensive plan that we've started implementing since around March. And it is bearing fruit because we can see governments are understanding where we are coming from and they are putting in place the mechanisms to ensure the healthcare systems are not overwhelmed. Now, the last question was civil society. You know, I usually say that we are the vaccine. As individuals, as communities, we are the vaccine. We can stop the virus from spreading if we have the right information and the right tools to stop the virus from spreading. And this is where civil society organizations become important. That civil society organizations are with the public. They are out there in the communities. They're out there in society. And if they take up this very critical task of providing information to members of the public, then we are going to see a big difference. And in fact, it is one of our strategies to work with the civil society organizations to get community workers in the communities. And we intend to put out 1 million community workers within the next 1 month, who are going to be supporting countries to provide correct information to members of the public, trace who needs to be traced, provide, guidance on what someone should do if they feel they may be exposed. So 1 million community workers we want to put out within the month. And the strategy of using community workers is based on the fact that civil society are the ones who are closest to members of the public. So if civil society were to come together and then use their networks, use their outreach capacity, we will be able to see a very big difference in the way that the numbers turn out in Africa. So I would encourage civil society that use your platforms, use your networks to provide the correct information, to support governments, to support members of the public with the correct information, so that we are able to slow down spread of the virus, and we are eventually able to stop spread of the virus, because we are the vaccine. Over.
Thank you so much. So unfortunately, our time is over, but I would just like for you to give, a conclusion, especially maybe a word of encouragement to innovators and entrepreneurs from the continent. And for the questions that we've received on social media, that unfortunately, because of time, we cannot be able to answer, we will forward the questions to CDC, and hopefully they can answer the questions on their social media. Please follow them on the different channels on social media. They're on LinkedIn, on Twitter, on Facebook. We will forward the questions so that you can get answers to those questions. So Dr. Ogwell, thank you so much. Please just give us a conclusion, a word of encouragement, or anything you'd like to tell African entrepreneurs and innovators.
No, thank you, Sheilah. For innovators first, let us use our skills and our knowledge to come up with different innovations that help us to go through this pandemic. We have enough innovators on this continent who can be able to come up with wonderful ideas and turn those into good products that can be able to help us. So I encourage innovators to innovate so that we can be able to have an African solution to the coronavirus pandemic. Second are the entrepreneurs, the traders, business people. We need to appreciate that a little pain now is going to open up our space for a lot of gain tomorrow. So if we ride through the pain of today so that we can be able to make the gain of tomorrow. And as we ride through the pain, it is an opportunity to reconnect with the self. It is an opportunity to reconnect with the family and society. It is an opportunity to plan so that when eventually the lockdowns are lifted, you are ready, you are shovel ready to be able to deliver on new ideas, new areas of work, indeed to support society with our different skills, experiences, etc. So for entrepreneurs, it is a painful moment, but when it passes, let us come back with new ideas and new thinking to make society better. And finally, is to say that this particular illness, COVID-19, has allowed us to press the pause button as human beings. Let us use the time that the pause button has been pressed to improve on the self, so that when the play button is going to be pressed, we become better at looking after our environment, we become better at looking after ourselves, and we become better at contributing to society. And finally is to say it is the individual who's going to win this particular test. The individual is the one that will win it by doing the right thing, by being the vaccine, by stopping the spread of this virus. I thank you.
Thank you so much. So for those who have joined us, we appreciate you. We are going to the SME support session after this to Dr. Ogwell and Africa CDC. We commend you for the good job that you're doing. We appreciate you. Thank you.
Thank you. Bye-bye.